Hello, and welcome to Bio 550 Human Anatomy. I am Dr. Kathy Lemley. I received my degree in physical therapy from UW-Madison in 1984, my Master's of Science in Human Kinetics from the University of Wisconsin-Milwaukee in 1999, and my Doctor of Philosophy in Integrated Neuromuscular and Rehabilitation Science from Marquette University in 2014. I am married with two grown daughters, Erin and Caitlin. I am a lifetime Girl Scout and led both of their troops all the way through their senior years of high school. I love to garden and I love to travel. So why am I teaching you anatomy? Well, first of all, I am passionate about anatomy and everything related to it. Throughout my degrees, I have taken as many of the anatomy and neuroscience courses as I was able to take. I am simply in awe of God's design of the human body. It never fails to fascinate me, the wisdom He used in putting us together. For 5 years, I served as a lab assistant in the Bio 550 course prior to taking over the class full-time in 2007. Learning anatomy is like learning a new language. It's going to take some time and it's going to take repetition. So you want to make sure that you plan your time wisely. The best kind of learning is active learning. Sitting back and listening to the lectures will not help you learn anatomy. You need to be active. You need to take notes. You need to draw. You need to make models. Anything that you can do to help you understand the anatomy. If you have a skeleton available at your place of work, I highly suggest that you use it and practice your bony parts and your joints. Use a whiteboard to practice drawing out muscles or nerves or arteries. You can also laminate handouts from your course packet that give you a background on which you can make your drawings. Palpate on yourself and on your family and your friends. When you are learning about a muscle, see if you can feel that muscle as it's working on another person or on yourself. Find those bony landmarks on yourself or a family member. Teach others. There is a discussion board located in this class, the course question board. This course question board is not just for questions for me. This is for everybody in the class to participate, both to ask questions and to answer questions. So teach each other. When you are able to explain something to somebody else, it not only helps the other person, but it helps to solidify that information for yourself and helps you to put it into words to make it easy to understand. Use the learning style or styles that fit you best. In this first week, you are going to do a learning style assignment. This is to help you learn how you learn best. And ask for help. Using the course discussion board to ask for help from myself and from your peers. Or I am going to be setting up a weekly chat. This will be a 1-hour time where I will get on to the computer in an open discussion forum. And you are free to ask questions throughout that time as well as the rest of your classmates. I'd like you to take a look at the title of this book. What got you here won't get you there. How successful people become even more successful. Although this book is written for business, it is just as applicable to the program that you are now enrolled in. You had to be successful to achieve a COTA status. You had to pass your coursework and then pass an exam. Now you are ready to move on to the MOT, and already you've had to take and pass coursework. But now you're in the graduate portion of the program. And if at this point and from this point forward, the things that you did to be successful, are not going to be the same things you're going to need to do to be successful through the rest of the program. One of the things that you're going to need to do is to change how you think about the information that you're receiving. And also, one of the things that you will need to do is recognize the importance and the value of self-directed learning. You will be given the basic information that you need in order to be successful in anatomy. However, you're going to need to take that information and not just repeat it back to me as you're likely used to doing, memorizing muscles and saying what they do and where they are located, and then replying back with that information. Now what you're going to have to do is to take that information, combine it with other pieces of information, and be able to put them together into one big picture. For example, if I were to tell you that the median nerve were injured at the wrist, you would be able to tell me what movements would be impaired, and take that even further to hypothesize what kind of functional problems might this patient have. What tasks would they find difficult? What occupations would be affected negatively by this injury? So it's taking the whole way through. Another example would be to give you a set of symptoms and then have you, based upon those symptoms, determine where the injury might be and what structures might be affected. Again, thinking about how this might impact your patient on a broader scale. So the strategies that you have used in the past for science courses, while likely to be very helpful in this course, you're going to need to go above and beyond those strategies in order to be successful, not just in this course, but in your remaining coursework. Now let's start with some basics. The cell. The cell is the basic building block of life. We are a group of cells put together. Cells contain molecules such as proteins, lipids, carbohydrates, lots and lots of water, and ions. One of the important proteins within our cells is called a laminin. This protein is so awesome. It is the coolest thing. It is the work of God, our Creator. Laminins are a family. They're an integral part of the scaffolding, the structure of our cells. They can self-assemble, so they can group themselves and bind to each other. But they each have unique and shared interactions. So they're very much like a community. Each person comes together with other people. They bond. They form groups and collaborations. And each different group and collaboration has uniquely shared interactions. It is through these interactions that laminins contribute to the distinction of the different tissues. And it is through these unique interactions that people create unique groupings. Laminins also are involved in the maintenance of tissue and promotion of survival, just like various groups of people are necessary for the survival of all. And this is what one of the most common laminins looks like. As you can see, it has a distinct reminder of our Creator. And just a little quote from Colossians. The Son is the image of the invisible God, the firstborn over all creation. For in him all things were created, things in heaven and on earth, visible and invisible, whether thrones or powers or rulers or authorities. All things have been created through him and for him. He is before all things, and in him all things hold together. Now let's talk about joints. So now is when we're really going to start the things that I'm going to be testing you on during this class. With the joints, I'm referring to the anatomical kind, not the kind that you might smoke. A joint is the joining of two or more bones. The degree of movement can vary. Some joints have almost no movement at all, if any, while others are quite freely movable, such as your shoulder. The most common type of joint in the human body is a synovial joint, known as a diarthrosis. In a diarthrosis joint, there is moderate to free mobility. So there is usually at least a moderate, if not pronounced, ability to move that joint. A diarthrosis joint is connected with the joint capsule. So the bone surfaces come close but not exactly in contact with each other, but they are surrounded by a capsule, a connective tissue wrapper, if you will, that helps to hold the bones together. This joint capsule contains fluid known as synovium, which is produced by an inner synovial layer of the joint capsule. This synovium, which is very slippery and slick, it's like an oil, helps to reduce friction so that the bony surfaces slide smoothly, helps to nourish the chondrocytes of the cartilage on the surface of the bones at that joint. Your cartilage does not contain any blood vessels, and the only way those cartilage cells, the chondrocytes, receive their nutrition is through the synovium. And the synovium works with the joint surfaces like a sponge, and that movement will push that synovium into the cartilage so that the nutrition can get to those cartilage cells. If a joint is immobilized, there is no movement in order to push the synovium in, and this can lead to cartilage damage. That's a big reason why we try to mobilize individuals as soon as their injury allows. It used to be that they would immobilize individuals for extended periods of time after an injury, and as a result, there was a lot of cartilage damage from poor nutrition. Of course, tissue needs time to heal, so sometimes immobilization is necessary. But you need to work with your physicians as to when it's safe to start mobilizing that tissue and to begin to recreate movement as soon as it's safe in order to allow for the cartilage to receive the nutrition it needs from that synovium. The outer layer of the joint capsule is a fibrous connective tissue. So you want to think of two layers, an inside layer, a synovial layer that makes the synovium, and an outside layer that is very fibrous. And this is really what helps to hold the bones together. A ligament, in many cases, is a thickening of this outer layer of the joint capsule. Sometimes ligaments are extracapsular, meaning they're completely outside and separate from the joint capsule. But in many cases, they are actually an added thickened area of that capsule with extensive fibers like collagen, which is a very strong protein, in order to add more strength to help hold the bones together. Here's a picture of a typical synovial joint. So you can see the bone in the yellow, and then in kind of the, greenish brown, that would be the articular cartilage. In the case of a synovial joint, we're talking probably a hyaline cartilage, Hyaline. Hyaline cartilage is like the gristle on chicken bones. It's very smooth, very shiny, and allows for this nice, with the synovium within there, allows for a nice smooth gliding movement. Then you can see in kind of the orangey color is the synovial membrane, the inside membrane that produces that synovium. And then you have this outer fibrous joint capsule. So what's the difference between a tendon and a ligament? Both tendons and ligaments are connective tissue. They're both made up of fibers like collagen. But tendons connect muscle to bone, while ligaments connect bone to bone. So tendon will go from the end of a muscle, and that's called the musculotendinous junction, to attach that muscle to a bone so that when the muscle contracts, it can make the bone move. A ligament will go from one bone to another bone. Ligaments are also connective tissues that might be supporting a visceral organ, like your liver, rather than running from bone to bone. So ligament has a couple of different definitions. But when we're talking about joints, it specifically is connecting bone to bone. Please now open up your lab guide to the introduction section. In part 2 of this lecture, we will go through all of the terms that you find in the introduction. Hopefully, many of these terms will be familiar to you, but there will likely be some new ones as well. Also, feel free to take breaks as needed, as the second part of the lecture is fairly lengthy.